trickling in and we can. Thank you.
Screenshot the slideshow.
Emily, are you sharing?
Okay. No, I think Shakufe, you will start with the sharing, right?
I see it.
Of the sessions before May 17th, so they can be live or recorded and complete the survey at the end of the session. As always, you have access to everything. Everything is uploaded within 24 hours on the Masterclass website. You have access to the recordings, the homework, the session resources, so you should be able to have it there. And also feel free to hop on over to ECD Connect to continue the conversation. The sessions all have one similar structure. We have the welcome and introductions. We have the masterclass itself, the dialogue with the expert, and participant Q&A. So be sure to engage in the Q&A, pop on over to the Q&A box, put in your questions there, try to have questions there so that we don't miss them. You have the opportunity to vote on questions you really like. And in the chat, please make sure you select everyone so that everyone can see. And I think some people are still selecting hosts and panelists, but just make sure you select everyone, as hosts and panelists is just the default setting. And also, if you want Spanish translation, we have Spanish translation available with our generous support from UNICEF Blackbird and our amazing translator, Mitzi, who's been working all week on this. So as I mentioned, we just had a session with Johnny Morel and Aisha Yousafzai, so you can catch that in the recording now. And we're so excited today to now welcome this session with Soumya Alva, who's a senior research monitoring and evaluation advisor at JSI. She's a social demographer by training with more than 25 years of experience leading monitoring, evaluation, research, and learning teams for data-led public health programming. She's currently a senior research monitoring and evaluation advisor at JSI Washington, DC, and senior MEL director for Momentum Knowledge Accelerator, one of the 6 USAID flagship reproductive health, maternal, newborn, and child health projects under the Momentum umbrella. And along with her, we have Emily Stammer, who's the research monitoring and evaluation advisor at JSI. She's a global public health measurement professional with over 15 years of experience working in both academic and program-focused settings. Her expertise lies largely in the area of monitoring and evaluation of reproductive, maternal, newborn, and child health programs using innovative mixed methods and adaptive approaches. She currently works for JSI on USAID-funded Momentum Knowledge Accelerator project, where she champions complexity-aware monitoring approaches and adaptive learning and works to build capacity in these areas across a suite of awards. And our early childhood expert, who is also ECDAN's chair of the technical advisory group, Dr. Mark Tomlinson, who is the co-director of the Institute of Life Course Health Research at Stellenbosch. He's also professor of maternal and child health in the School of Nursing and Midwifery, Queen's University, Belfast. His scholarly work is primarily interested in how to improve early childhood development, child and adolescent mental health, maternal mental health, and developing life course approaches to improving health. And with that, I hand it over to our incredible panelists.
Thank you so much, Shakufe. Emily, are you sharing the slide?
Yes, should be.
It's not in presentation mode. Yeah. Okay, great. Thank you. Good morning, good afternoon, good evening to you all, depending on where you are. Today, Emily and I will be talking about complexity-aware monitoring approaches for adaptive and context-specific program improvement. I'd like to start by giving a quick overview of the session. We are first going to start with an introduction to complexity-aware monitoring approaches. What is complexity-aware monitoring, and what are some of the key concepts associated with complexity-aware monitoring? Next, we will give a brief overview of a few complexity-aware monitoring approaches. We will link them to research questions that can be answered and offer guidance to quickly compare selected approaches and resources to support their use. You will also see how the findings of complexity-aware monitoring can be used for program learning and improvement. The content of this session is based off of multiple resources that have been developed through the USAID-funded project called Momentum, which I'm going to describe a little later. This session draws heavily from the Complexity-Aware Monitoring Guide. You see the cover on the left side. That was developed in 2020. It's a bank of resources, including an overview of the different methods and examples showing when and how the different methods may be used. There are other resources from Momentum, such as the Adaptive Learning Guide and the Adaptive Learning Toolkit, that provide an introduction to adaptive learning, including key steps to integrating adaptive learning into your work. It also links to existing resources and real-world examples of how adaptive learning can drive continuous learning and improvement in project work. In this session, we will also draw upon examples that we use to answer questions in different projects implemented through USAID, such as Momentum and Breakthrough Research, as well as organizations such as JSI and its affiliate in Supply Health. Before we get into the details of complexity-aware monitoring, I'd like to share a little information on Momentum, the project through which much of the resources I mentioned earlier on complexity-aware monitoring and adaptive learning were compiled. Momentum is USAID's flagship project, focusing on accelerating reductions in maternal, newborn, and child mortality, as well as improving access to voluntary family planning and reproductive health. It is a suite of 6 centrally managed global awards, plus the USAID mission-led bilateral projects that are also connected to the Momentum umbrella. Coming with this background, some of our examples touch upon the global health field, but are easily adapted to different contexts. Now to get into the details of complexity-aware monitoring approaches. Let's do a quick poll before we start. Shreya, could you run the poll, please? Yeah, please use the Zoom poll to answer this question. How familiar are you with complexity-aware monitoring approaches? Just give a minute to answer this question. I hope you've all had a chance to answer this question. How familiar are you with complexity-aware monitoring approaches? Can we see the results? Okay, so we have half the group, 49, that says, I've never heard of the term. 10%, I understand all the words. 30%, I've heard about the term, never used it. And 10% that say, I've worked on a project that uses approach. So we're going to start off on a clean slate then. And I hope this session provides you all the background information for you to get more interested in the topic and dig into some of the resources that we've developed for more details. Thank you. So now let's move on to the details of this approach. People always want to know, what counts as complex? Is what I'm doing complex? Here is one way to think of and define complexity, and with thanks to Michael Quinn Patton. So as the figure shows, complexity is a continuum between simple and chaotic. It occurs when there's a lack of both strong expertise and agreement on what needs to be done. A situation can be complex as a result of the intervention, the context, or both. Moreover, complexity could be socially complicated or technically complicated. This slide also shows 2 questions that are important to answer. Are you implementing a simple, straightforward intervention in a stable, well-defined environment? Do you expect your work plans to be implemented as originally written without delays or changes? In many instances, maybe in most instances, the answer to this question is no. This makes them very good candidates for using these methods. Now, I'd like to get into what complicated means. In many projects that are being implemented, there are certainly social complications. People, ideas, and resources from one country, example, the US, where Emily and I are based, are trying to come together with people, resources, and ideas from other countries to fill gaps. And within the same country, people, ideas, and resources from one group, such as urban professionals or government officials or healthcare workers, are trying to create change with another group of people and their resources and ideas, such as farmers and mothers or nurses, doctors, religious leaders, or teachers. If you're holding stakeholder engagement meetings, you're probably doing that to try to overcome some of these inherent social complications in your project. That's not the only kind of complication. You've probably seen this image before. The idea is that reality is not as neat as planned. Do you feel like it describes your work?
Good. How's your day? It's also
Sorry, Mark, I think, could you put on mute, please? Yeah, and your video's on. You've seen this image before, the idea that reality is not as neat as planned. Do you feel like it describes your work? Do you have good days and bad days? Days when the data goes in the right direction and days when the data does not make any sense at all. That's what we mean by technically complicated. Here's a summary of some of the aspects of complex interventions and complex systems that we've talked about so far. You could have unclear causal pathways to outcomes, lots of changes happening at the same time, feedback loops, numerous outcomes. And then we also work in complex systems with numerous diverse stakeholders making consensus impractical. We work in a context where contextual factors influence the work that's being conducted. There's new information that's continuously being introduced. We're not working in a static environment. We're also working in an unpredictable environment with a high pace of change. So this is when we use complexity-aware monitoring, where it's most relevant. So what is complexity-aware monitoring? Complexity-aware monitoring is appropriate for aspects of strategies or projects where cause and effect relationships are poorly understood, thereby making it difficult to identify solutions and draft detailed implementation plans in advance. Expected results may also require refinement and revision as strategies and projects unfold. Projects or parts of projects that rely heavily on adaptive management to steer effectively in dynamic contexts, and projects that seek to influence social change or innovate to discover solutions are likely candidates for complexity-aware monitoring. On the other hand, there are projects that deliver services or roll out or replicate or scale up tried and true programming strategies that are not generally a good match for these monitoring approaches. The application of 3 key principles that are mentioned in this slide can be invaluable for monitoring the emergent and dynamic aspects of strategies, projects, and activities. When you apply these principles to your own situation, you may discover new monitoring solutions. Most monitoring plans do not address a broader range of outcomes associated with the intervention or system, including intended, unintended, positive, or negative outcomes. Sometimes there are alternative causes, other actors and factors that contribute to outcomes. We also recognize that sometimes change that is nonlinear, meaning results are often achieved without a clear, crisp, and constant relationship among the variables. The second principle is, as the pace of program adaptation quickens or slows to match the pace of change in the context, monitoring must adjust if it is to continue to provide useful information. And finally, we need to consider interrelationships, perspectives, and boundaries. 3 central systems thinking concepts can guide monitoring in complexity, as I've mentioned: interrelationships, perspectives, and boundaries. Taken together, these 3 concepts outline the scope, focus, and intent of the systems field. Some of these issues may have been covered in the earlier presentations as part of the series. Anyway, so now we know what complexity-aware monitoring is. When do we use these methods? The next part of this session focuses on matching complexity-aware monitoring approaches to research questions that we want to answer. As we mentioned earlier, when we work in complex scenarios where interventions are complex or the system is complex overall, how do we monitor and evaluate programs? Traditional performance monitoring and evaluation is not feasible in this challenging scenario, and there may still be many unanswered questions. Complexity-aware monitoring approaches help to answer several key questions that these scenarios raise. Some of these questions, based on the concepts and principles I just mentioned, are outlined in the slide. What outcomes might we be missing? What outcomes might yet emerge that haven't shown up so far? There may be many unanticipated outcomes that may arise during program implementation. How do the different stakeholders perceive the intervention? They may all have different perceptions. What factors contributed to the observed outcomes? And what's happening in the wider context that might influence changes that are taking place? There are several complexity-aware monitoring methods that you can pick from. The complexity-aware monitoring guide that I mentioned earlier offers a good summary of these methods. In this session, in the interest of time, we will go into 4 of these methods. The methods we'll be talking about are pause and reflect, outcome harvesting, most significant change, and ripple effect mapping. We chose these 4 approaches to highlight as we feel that they're particularly well suited to the work that we do in public health, and they're among the most well-known and often used approaches within the USAID community. I'm sure you'll find these equally applicable to your work as well. So let's start with pause and reflect. Pause and reflect is something we're all probably doing in our own way. It's great for everything, and there are so many ways to do it. It's a low-touch but effective approach that basically involves collecting information that can be analyzed for program improvement. It's an opportunity for program implementers and research staff to sit together and reflect on what happened. A project can pick critical points during the implementation period when this activity can take place. So there are several examples of pause and reflect that are highlighted on the right. They're program reviews, quarterly check-ins, team meetings, communities of practice, after action reviews, and so on. Here's an example of pause and reflect. So the project I work on, Momentum Knowledge Accelerator, seeks to understand on a regular basis how the project can adapt and improve its processes by using pause and reflect. On the right side of the slide, you can see some of the questions that you can ask during a pause and reflect activity. What was planned? What really happened? What went well? What did not go well? What should we do next time? The team then documents this information, reflects on them, and decides how to incorporate findings into program improvement. The next method that I'm going to talk about is outcome harvesting. Much more complicated than pause and reflect. It's typically used later in a project implementation process. It also follows a retrospective narrative approach. So project staff look for outcomes, and then they work backwards to understand the role of the project in contributing to them. So outcome harvesting could go by many names. Sometimes it's also referred to as forensic monitoring and evaluation. So you get to be the detective who's sleuthing about for outcomes to capture. It's particularly useful in cases where there's limited valuable quantitative data. Also, when there are interventions for which you expect there to be unintended outcomes, or cases where pathways to outcomes are unclear or results are difficult to measure. There are 4 groups of people involved in the outcome harvesting process. The first is project staff. So these are people who provide data on the project and context. We then have the primary intended users. These are people who require the findings to make decisions or take action. This could include donors, organizations such as foundations, or a country government. We also have change agents. Change agents are individuals or organizations that influence outcomes. Example, these are people who run the program that we're talking about. And finally, outcome verifiers or substantiators. Third parties who are both knowledgeable and objective about outcomes and are in a position to verify the results. So the outcome harvesting process follows 6 iterative steps. The first step is designing the outcome harvest. You focus on what actionable information is needed for the primary users. The second step is gathering data and drafting outcome descriptions. So what we do is collect data from project sources to draft descriptions for each of the outcomes we're interested in. Thirdly, we engage change agents in formulating these outcome descriptions. We then substantiate. We have knowledgeable, independent individuals who validate these outcome descriptions. And finally, we analyze and interpret. We provide evidence-based answers to harvesting questions, which are then used. I'd like to talk next about an example of the use of outcome harvesting across 4 projects implemented by an organization in supply health in Kenya and Tanzania. So these were 4 complicated projects focusing on interventions to improve the supply chain at the community level and the use of data following the impact team approach. Impact teams are a quality improvement approach to review and interpret data and prioritize problems and find solutions. I'm not going to get into the details of these projects, but just to note that the 4 projects followed a similar timeline. They had a number of intended and unintended outcomes. So the objective of the outcome harvesting activity was to generate evidence around the intervention components that lead to sustainable community health models. So an outcome harvesting was conducted in the last 6 months of the projects. And as I mentioned, they had overlapping timelines, so they were all ending about the same time. So 45 outcomes were identified and harvested across the 4 projects and described based on the questions that were asked. Based on a very iterative process where the groups related to each of the projects sat together to verify the results, a smaller set of findings were identified where there was enough evidence to substantiate the relationships to outcomes. So as I explained earlier, we had these 4 projects being implemented. Towards the end of the projects, an effort was made to identify all the outcomes that were achieved. So 45 outcomes were harvested. They were all described by the project staff. And later, all the key stakeholders came to a meeting from the 4 different projects. The 4 groups that we're talking about came together at a meeting where they sat and discussed the 45 outcomes. And there was an iterative process to try and verify the results. So there were these verifiers and substantiators available as well during that process, as a result of which a short list of outcomes and findings were highlighted. A few of these examples of shortlisted findings are presented in this slide. As mentioned earlier, this is a very powerful method that captures information on outcomes in difficult situations with very little information. It's a very iterative and participatory approach, bringing different groups of stakeholders together to identify and discuss and verify the outcomes. At the same time, it comes with its own challenges. It can be a difficult and tedious process depending on the number of outcomes you come up with. It's an iterative process, as I mentioned, and depending on the groups, a participatory approach is not always feasible and doesn't always show the results. It's also a very tailored approach specific to each project and cannot be generalized. This can be an advantage, can also be a disadvantage because the findings cannot be generalized to the broader situation. The next method I'm going to be talking about is most significant change. This method is great for interventions and projects with diverse stakeholders and is commonly used in community-based interventions like social norm change, but it can be used in many different types of interventions. Like outcome harvesting, this is also a retrospective approach that's used in a later stage of a project lifecycle. It prompts a wide range of stakeholders, including program participants and staff, to tell their stories of the intervention. As the slide outlines, when we use this method, stories that are told are prioritized to understand what is most significant and what values are held by stakeholders. The storyteller assigns contributions to the intervention. And the key domains of change and areas of focus are then identified. I'm going to explain this a little bit further, showing the process that's followed. As you can see in this graphic, there are 6 steps to be followed. In the first step, you identify the question, which has a very specific format. For example, you could say, from your point of view, can you describe the most significant change that has resulted from program X or intervention Y? That's the question that's primarily asked. The next step is to tell a change story. It's helpful to do a short training with the storytellers to get them comfortable telling the stories and to discuss what makes a good story. The program can use a sample most significant change question that's relevant to the participants, but is not the actual question to be examined by the project to practice storytelling. So it becomes important for everyone to tell consistent stories, and that's why it's important to kind of train them and say, this is a kind of question I want to ask, tell your story based on this. Step 3, in small groups, you record the reason for the selection when we're shortlisting stories. Why are the changes valued by the participants? This is when they're shared in small groups. One thing to note is that most significant change is usually conducted to complement quantitative data collection. So there's some level of verification. We don't usually verify other qualitative data that we get. So we follow these 6 steps. We have the open question about change. It's small groups. You ask people to tell a change story. And then in small groups, you select a smaller number of stories and discuss in the larger group, and you repeat the selection process. Then you identify the different domains that the stories illustrate, and then they're verified. So here's an example of a most significant change that was used to understand the effects of a multimedia campaign using social media, mass media, and community activities. With the overall objective of improving reproductive health and family planning access for young people in Francophone Africa in 9 countries. I'm going to be talking about this example in one country, Niger. The focus was on reducing the impact of social norms that prevent youth from accessing family planning and reproductive health information and services. The next slide shows some of the questions that the most significant change activity tried to answer in Niger. So they were trying to understand what were the changes in communication between adults and youth related to family planning and reproductive health. What were the changes in knowledge and attitudes related to this kind of communication between adults and youth? What were the changes in actual use of family planning, reproductive health services, all as a result of the mass media campaigns that were held? On the right side, you can see the methodology that was followed. So they had 24 focus group discussions that were conducted, covering different groups of males, females, adolescents, young adults, parents. In all, there were about 145 participants. The participants included those who were exposed to the campaign. So this was the MMH campaign event, social media exposure, and so on. So the topics of the stories were community level attitudes and perceptions about youth and family planning, reproductive health, exposure, perceptions, and recommendations about the campaign. And they elicited stories on the different domains of change: communication between parents and young people around family planning, approval of young people using family planning, favorable attitudes towards family planning, and how it helps young people reach their life goals. Other domains of change, for example, reduction of high-risk behaviors. So following this process, a selection panel was formed to identify the best stories based on criteria established. And then they were triangulated with other data. So here's an example of a story that came out of this activity. So the story reads, I'm a midwife and mother living in Niger. Before, when I received pregnant women at the health center, especially the younger ones, I moralized them. Because of this, many patients found my attitude stigmatizing. But the Merci Mon Heroes campaign, in which I took part during a seminar, has since changed me. It is with empathy and encouragement that I now welcome young girls who are unhappy to discover that they have become pregnant. So you can see in that last sentence the effect that the multimedia campaign has had in changing the attitudes of parents and adults towards young women with regard to family planning and reproductive health. So similarly, there were many other stories that were shortlisted that as part of this process. So one challenge in the use of this method is social desirability bias. Those in groups will tell you what you want people to hear. Moreover, the stories we get also depend on the people engaged. So it's really important to get the right sets of people to tell stories. To answer some of these concerns, it's important to identify the right people to participate and a clear selection process, and to make sure they're all well exposed to the intervention so the responses and stories are meaningful. The last method I'm going to be discussing is ripple effect mapping. This is a discussion-based method. It's used to understand the different effects or ripples of a complex program on a community or beneficiary. Again, this method is very useful in complex evaluations. It has a strong visual component, as I will show, and needs good facilitation and evaluation skills to be successful. Here's an example of a ripple effect mapping exercise, where an intervention is identified and it's noted in the middle, and the question is asked, what was the outcome? And so we go on and on asking about additional outcomes. And these are written around the intervention in a group setting. And then we ask the group, what other outcomes may have taken place? They are all then written out around the intervention. I'm going to outline the process that's followed to conduct ripple effect mapping. So there are 3 steps to be followed. The first step is appreciative inquiry interviews. These are peer-to-peer interviews in pairs using a set of standard questions and a script. So there are 2 people involved in this process. There are multiple pairs going on. So the content of these interviews are, tell a story about what is an achievement or success you had based on the intervention. Has the project helped to maintain or improve things? What new or deepened collaboration or partnerships, etc., have you made as a result of the intervention? So the next step is a group mapping or reflection exercise, where each pair offers one story, only one at a time, and you have a facilitator who probes what, who, and how. The last step is an analysis of the mapped information. What's the most significant change or ripple? How are these ripples different from each other? Is there anything missing from the map that was developed? What should we do next? As I mentioned earlier, good facilitation and analysis evaluation skills are critical for the success of this activity. Here's an example from the data use project in Kenya. This project used impact teams, which are data review teams, to use data and information analyses for evidence-based performance monitoring to allow continuous improvement of supply chains. So the intervention was the impact team. And the main question that was asked was, what are the intended and unintended outcomes of implementing impact teams? There were additional secondary questions that were asked. What has been the most helpful part of the impact team approach? What are the major changes as a result of the impact team approach? What are the unexpected results of the impact team approach? And these were all mapped first, talking to people individually in pairs, and then mapped similar to what I had mentioned earlier with the graphic. This mapping process could be on a whiteboard or a chart where they're written by hand. You could use software to engage in this mapping process, And it's very important to have a really good facilitator to walk through this entire process. Now I'm going to hand off to Emily to talk about when and how you choose the right method to answer your questions.
Thank you, Samia. I will turn it over to you for screen sharing.
Yeah. Is this okay?
I think you need it in presentation mode.
I think I did that.
And it's showing presentation mode now. You have to switch screens.
Is that good?
Yes. Let me go to the next slide.
Hold on a second. Yeah.
Great. Okay, so thank you so much, Samia. At this point in the presentation, I'd like to walk through an example that I have tried to make ECD context friendly. As you know, our background is more in public health, so I'll do my best. And we can talk through how you would choose your approach or approaches, and I'll give some brief thoughts on that. So next slide. We have a little bit of a case scenario here. I know the text is small. Sounds like is someone having trouble seeing the slides? I think we can see them. Is anyone else having trouble? It's okay. Okay. All right. Great. We'll keep going. Okay. So for the case scenario, I'll read it aloud and provide a bit of additional explanation and then give you a moment to review it. So officials in Project Z in Country Y are wrapping up a big project that focuses on nutrition and child health. And they're interested in looking back on an advocacy campaign they did back in 2022 that focused on promoting integration of responsive caregiving promotion into routine well child growth monitoring visits. So for those who may not be familiar with these are well child visits. They take place usually a number of times in the first year of life, then about every 6 months, and then annually starting around 2 or 3 years of age, where children usually come in and from a provider get preventive care like immunizations. They're usually weighed and measured, and the provider often talks to the caregiver about their diet and reviews some of the developmental milestones. So the focus of this advocacy campaign conducted by a local organization was to advocate for the inclusion of education around responsive caregiving into these visits for caregivers. So for example, the provider would be encouraging caregivers to use a positive and supportive tone with their child, or showing physical affection, or responding to a child's distress in a timely manner. So the project was just going to advocate for inclusion of these services, not implement them, into these well child visits in, say, 3 pilot districts in the most remote areas of the country. So following the advocacy campaign, which targeted province and district government officials, local organizations working in the child health or development space, community leaders, and other stakeholders, which ended last year, in 2023, the project now wants to know what the effects of the advocacy intervention were generally, and if or how the project might have affected nutrition or developmental outcomes in children, so they can use this information to plan for programming in the next phase of the award, which we'll say begins in 2025. So I'm going to give you just a moment to digest this before we move on to the next slide. This scenario is included in the handout that was either posted or sent out for reference. But before we get any further, I do want to suggest that there will likely be different options for different pieces of this work. And I think that answers a question that was up in the Q&A. Can you use multiple approaches? And the answer is yes. That's okay. There's going to be some mixing and matching involved, and there's really no one right answer. So let's move on to the next slide.
So I'm having trouble with this now. Don't know how to move this to the next slide. Okay.
There you go. Okay. So now we'll walk through selecting the approaches. As we go through these questions, based on what we've discussed so far and what Salmia presented, if you have ideas about what approach or approaches might be appropriate, please feel free to enter them into the chat with your thoughts. So if you refer to your handout, if you have it, and the slide, these are some of the questions you can ask to narrow in on which approaches might be most useful. So first, you're going to ask, where are you in your program cycle? What questions do you need to answer? And what resources do you have or need to implement the approach? So these are the questions we'll focus on to narrow down your selections, but there'll obviously be other questions you'll need to ask yourself when getting into the details of an approach, like cultural appropriateness, that kind of thing. Next slide. So the table here that you're going to see in the next 3 slides is presented in the Momentum Guide to Complexity-Aware Monitoring approaches that Salmia mentioned earlier, and it includes a few more approaches in case you're interested. We pared it down a little bit just for the sake of time. And I really encourage you to take a look at that. It's a very helpful table and is easier to read in the guide than it is on the slide. So the first question we can ask is around when in the project life cycle we are doing the work and need the answers. Some of the approaches are best suited to do early on to really guide conceptualization, and some are best suited to do later in project implementation. Though really all of them you can see from the slide can be used toward the ends of the project or as part of evaluations, which you will see here. So back to the case scenario. In the scenario, we're at the end of the project, looking back at an advocacy intervention that ended over a year ago. So we're looking for approaches that are best suited for evaluation, which in this case doesn't really narrow down the approaches at all, as all of the approaches in this table are easily adapted for evaluation purposes. So next slide. Great. So next, we'll ask which questions we need to answer. Here we have the 5 missing and difficult questions that Salmia discussed earlier, and the CAM approaches that are particularly well suited for answering each of the questions that are indicated with a dot. So advocacy interventions, like the one I described, can be tricky sometimes because the outcomes aren't always easily predicted or straightforward, or they take time to occur, particularly when you're, say, proposing ministry funding for something and they have their funding cycles and then COVID hits and all kinds of things that make up these complex environments. So perhaps in this case of this scenario, let's say the teams did some interviews early on after the advocacy work was done and found that the districts hadn't implemented the intervention into those well child visits. But now, as the larger project ends, project staff are hearing more and more in the community about responsive caregiving. And they're wondering if there may have been other outcomes or anything was missed. Maybe it just wasn't important to look just at that outcome of incorporation into well child visits, but could there be other effects? So in this case, they would be looking for an approach to help identify outcomes that might be missing, outcomes that might still emerge, and given the interest in the how, they might be interested in what factors contributed to any outcomes they identified. One more. Thanks. So looking here, we have some common approaches across those questions, largely ripple effect mapping, with outcome harvesting, most significant change, causal link monitoring, and outcome mapping, answering at least 2 of the 3 questions. So we've narrowed it down maybe a little bit, but let's move on to the methodology and resources needed to see if that changes anything. So, and again, apologies for the small text. I would defer you to the CAM guide where it's easy to read. So on this section of the matrix, we show that many of the approaches can be either or both qualitative and quantitative. Then we look at the ease of use in terms of skills and resources and level of effort. Can these approaches be integrated into existing staff workload, or are dedicated staff needed for a longer-term engagement? Finally, type of engagement gives an idea of how engagement can be done. Do you do it from your desk? Can it be done virtually, or is this going to require in-person engagement? So just a note, all of these, this whole table, all of these are just approximations. All of the approaches are highly adaptable and context dependent. Ease of use may vary by how the project chooses to implement it. So, and while adapting CAM is a highly participatory way, and that may be more challenging and time intensive, just know that so much of the rich value that comes from some of these approaches comes from that participation. And this case scenario was built to provide a lot of space for different options. So it isn't particularly realistic. I mean, you have a team with a good amount of time and availability and resources. And, you know, from there, you should know that it's fictional. So we said that most of the team, let's work through this for the case scenario. We said most of the team has a qualitative background, so that's going to be useful across all of the approaches. But without the quantitative piece, it may knock out a few options like contribution analysis, outcome mapping, and causal link monitoring. However, you could also take a more qualitative approach with those. They're quite adaptable. So our staff are skilled, they have the resources, they need to travel, purchase, and use different software and available locally, so they can engage stakeholders in person. And so those rows aren't particularly limiting in this case. So in the end, it seems like ripple effect mapping might be useful, as it's well suited to answer our 3 questions and is within our resource parameters. Outcome harvesting and most significant change can also contribute to piecing together information about what outcomes may have emerged and how. Pause and reflect would also be a great low intensity resource light way to help answer some of the questions that we have. The other approaches could also contribute to parts or pieces of the questions. So, you know, the answer is you could use most any of the approaches to answer pieces of the case scenario, but the few that I mentioned may be best suited. And for the purpose of this session, we're going to pick 3 that might be most useful that Salmia happened to also touch on earlier and walk through how you might employ them together. And we're going to start with ripple effect mapping. So with ripple effect mapping, and I saw there was a question earlier about the different colors in the ripple effect map. I think in the other map earlier, perhaps they were used to help with some of the thematic analysis. In here, the colors really just represent, you'll see when we get to the end of the slide, the colors are just going to represent the different layers of the ripple. So with ripple effect mapping, if you were going to use that, you would identify the stakeholders you hypothesize may have been touched by the program. In this case, it could be the targets of the advocacy. So your government officials or community leaders or these community organizations working in the child health or development field. You could convene these stakeholders, whether together or separately. That's going to depend on the context. And you'd facilitate 1 or more sessions to discuss the intervention and its effects, both intended and unintended. So usually, one person is facilitating while another person is recording responses and mapping the responses in real time, which does require some rapid thematic analysis, all while the facilitator probes for more detail. So to map, you'll start with the program in the center, like you see on the slide. After stakeholders engage in the appreciative inquiry piece and document their reflections, you'll ask one group to share their story or one effect the program had, and write that down with a connection to the program. You might then probe a bit more to find out what happened and write that down. Then probe some more. As you're doing this, you should encourage the group to speak up and say if they had different experiences. In doing this, you find out someone else has something else that happened and you can write that down. So you keep doing this, going around until each group has shared and there's no more effects to share. You write them all down. Now you can see how all these things move out from the center like ripples. Maybe through this process, you learn that while the targeted districts did not incorporate responsive caregiving into their well child visits, one of the community organizations that was targeted that also happens to support community health workers in the area received the message and has started to incorporate the messaging regarding responsive caregiving into events that community health workers hold, like community sensitization events and mothers groups. So you can see how this approach would help you map out a pathway of effects, and then you dig into these results more. So once you have what you think is a final map, you'd work with it to try to identify sources to triangulate the map to help validate your results. Next slide. Great. With outcome mapping, or outcome harvesting, it's the opposite. You start at the end or the outcome level and work backwards. So let's say the district hadn't incorporated responsive caregiving, like we said, but program staff sensed the climate around responsive caregiving had changed in the communities. Community leaders seem to be more aware of the concept and maybe more open to some of the concepts. And program staff suspected that perhaps it was due to the advocacy work, but weren't sure how. You could begin with that outcome and work with the project team to use existing information, documentation, and literature to craft verifiable outcome statements that you could share with the community leaders and ask them to clarify, and work with them to refine the statements through an iterative and participatory process. Then, as with ripple effect mapping, you're going to substantiate these statements with any external data, sources, and document. It's so important. You'd analyze and interpret and support use of the findings within the organization for the scale up or the next award cycle, as we said. But you can see from this example that you'd have to have an outcome in mind and a theorized pathway, and then evidence to back it up. This wouldn't be a good approach for looking for outcomes that hadn't yet emerged. Next slide. So finally, this case scenario would also lend itself to most significant change as well. Let's say you follow this lead on the change of the community climate based on the advocacy. The project brings together community leaders and asks for stories around changes in behavior and social norms that may be attributable to the advocacy intervention. The stories go through this review process that Salmia described earlier. Those reviewing, and through that process, those reviewing are going to get a better understanding of what the community and community leaders value and how and when change occurred for them. Then they would, select among the stories to identify the most significant change. As with other approaches, you'd support these findings with additional data sources for triangulation. This has been a very brief overview of how each of these approaches would be used, just to give you an idea of how they could be used. But in the end, all the approaches will help give you a better understanding of the system, who's involved, how the pieces are connected, and how the intervention unfolded, and give you an idea of the effects. So with the prescribed preconceived impacts, like changes in nutrition or development status that we mentioned, these may require additional targeted quantitative or qualitative research to see if they were realized. But the complexity-aware monitoring approaches would bring you to a place where you can better understand the pathways and have a better sense of the whole picture and if and how those outcomes could come about. So I hope that case scenario was helpful in thinking through how approaches might be applied. So in closing today, I wanted to circle back to what complexity-aware monitoring approaches are and how they might be useful in our work. So they're useful for identifying intended, but also unintended, and even unfinished outcomes. They can help identify factors that contribute to change or success and help us better understand perspectives and perceptions of stakeholders. And finally, they can help us understand the ever-important context that our work takes place within. These approaches are also particularly well integrated as part of adaptive learning and management, where continuous learning and feedback loops are used to inform decisions for program improvement. Let's see. So next slide. And next slide. So as we conclude this section of the masterclass, I'd like to take the opportunity to provide a QR code that will bring you to a website with a number of resources curated across the Momentum projects that focus on topics like complexity-aware monitoring, but also adaptive learning and management. A more elaborate list of resources is available on the ECDAN session page. I think that I mentioned earlier and that I encourage you to take a look at. I want to just thank you all for your attention and your engagement at this point. And I would like to hand it over to Mark for the ECD expert dialogue. Thank you.
Thanks so much, both. That was, yeah, absolutely fascinating. I also, yeah, I just want to first up say that I have been monitoring the question section, and there are questions there, both in the question and answer as well as the chat panel. And so I'm not going to speak for too long because it would be good to be able to get some time for Sumia and Emily to answer any questions that come from the floor. So just a couple of points. The one is I love the concept of complexity-aware monitoring, and I always think of, and I'm guilty of this. You know, I've designed a lot of randomized controlled trials where we are designed to improve some aspects of parenting or responsive caregiving, and I'm often left with the feeling that, you know, and because we want to be cost effective and because we want it to be scalable, we then have few sessions, and you know, and then we imagine it's going to work. And I often imagine some of the participants, the parents, thinking, does he have children, or do they have children of their own? Do they realize what it takes to have a conversation sometimes with a 15-year-old who's cross with you, and you telling us about like communication is important? And so there's something, I know it sounds obvious, but there's something quite profound about the complexity of the interaction between a parent and their child, between and you know, in terms of an organization as well, between communities and other community members. So I just think there's something just intrinsically fundamental about that. I'd also like, and this I'll just pose as a question, is you talk quite a lot about, you know, complicated and complex, and I'll pose this question for the two of you to answer at some point as well. Is like, how's that different from, and maybe this sounds obvious, but difficult? You know, something could be quite difficult to implement. It doesn't actually mean it's complicated. And so what's the difference between particular sort of obstacles in an environment or in an organization or institution that make something difficult to implement or whatever, that may not be about complicated or complex, but I just put it out there. I also, one of the, you talked about, at one point, I think it was some of you talked about generalizability. And I think that's such a key thing, because I think for many people certainly in the early child development field that I come across, and part of my bias, of course, is I'm in a research institution, but there's this idea that the evidence from 2 or 3 randomized controlled trials conducted in 3 countries is generalizable evidence. And I think that that's a misnomer. I think that there's you know, that I think at best what they do is they say that here's an intervention that you're implementing somewhere in these conditions at that moment in time with these people running it. And if all of that were to be replicated exactly, then it might be generalizable. But in fact, it's much more complex than that, you know. And so we did work adapting something called the Alberta Context Tool, which literally takes something like a randomized controlled trial evidence, and it was developed in Alberta in Canada, and we adapted it, called it the coach tool, a child context assessment tool. And the idea being that you can take something, literally, you could take something from Vancouver with evidence in a hospital in Vancouver, take it across to take it to Toronto, and it fails miserably. Same evidence, but the leadership of the hospital is different, the resources are different, staff motivation is low. And so I think we have to be very careful about assuming that once we have evidence that means, you know, and I think one of the, and of course it's suggestive, you know. And one of the studies I always talk about in early child development, probably the most famous study is the Jamaica study. That's Susan Grantham Walker and Susan Walker developed, you know, where they've found, you know, not only really good results early on, but results that actually, you know, they can track impact 30 years later in individual children in terms of, for example, as adults, you know, money earned. Many studies in the rest of part of the world haven't found that when you follow up long term, they don't. And I think things like context and things like complexity and trying to understand it are really key, because I think, for example, in Jamaica, actually preschool attendance, for example. So if you're going to do an intervention in the first couple of years of life, almost 100% at the time of that study of kids were in preschools of relatively good quality. And in fact, primary schools in Jamaica are pretty good. In fact, a lot of their teachers are now being stolen by the United States because they're so good. So teachers are very good. And so benefits early on, if they get reinforced by a quality system, even if it's not the best, is different from another context where very few children go to preschool. Primary school education is low. So I think it's really important to just hold that. And I think a complexity lens does offer some of that, because it, you know, and then linked to that, two last points is, by definition, it's talking deeply to people, whatever the kind of person, you know, whether it's community members, stakeholders, parents, and that deep engagement really has to be where things start. You know, we haven't done enough, for example, and obviously it's difficult in early child development. We haven't done enough talking deeply to parents, to children themselves. And obviously you can't get much, you know, useful information from a 6-month-old. But we haven't been good about talking to their siblings, to understanding what the contexts are like. So again, this is very, very useful in that. And sorry, there are two other points I want to make. The one is also I think there's, because of the community engagement, because of the deep engagement, the ability to measure what's important to people is really, it is front and foremost. Where so much of what we do in research certainly is we develop tools that we've then validated, normed, and seem to manage something. And then we end up measuring believing that what the tools measure are what's important, because we've got them, as opposed to asking people what really matters to them and then finding ways to measure that. And I don't think if you do a deep complexity aware lens that you can possibly then do that, because you have to listen to people and ask what's important to them and what's important in their lives. And also, just there was this will be my final point. One of the questions I think that in the chat was about sort of convincing people about in a country about the importance of early child development. And this is also something I'd like the two of you to maybe comment on, is strategically, I wonder if, for example, you're trying to advocate for and to build a new field somewhere. And I don't know the answer to this. I think I've got some ideas, but in the early parts of that advocacy, in the early parts of trying to build a frame, would a complexity-aware view be the deep community engagement is important, but does one at that stage speak to the complexity, or does one try to make it a little bit more simple to get the buy-in, to slowly build some commitment, some funding, some resources, and then as the field, if you were to see it as a continuum, then builds, it gets more and more complex. So just, I don't know the answer to that. And there's a part of me thinks, well, when would you not want to talk to people deeply? But at the same time, sometimes it is about maybe just being much more simple, just to build a field. Yeah, so I'm going to stop there and just thanks again for fascinating journey through this, and I loved some of the terms like ripple. I loved it. So thanks so much for that, and let me hand back to you for the two of you to kind of respond initially, and perhaps I think then Shikupe will take over and share the questions and answers. Thanks both.
Yeah, thank you so much, Mark. I think you brought a lot of good points. I think you started off with complexity and comparing it to complicated versus difficult. And sometimes they could be the same and sometimes very different. You could have a difficult scenario where you're trying to implement something, there is no policy in place, or the government is just not supportive. This is not the right time to do it. You don't have the right staff to do it. And so it's really difficult to do something. Or you're trying to implement a project in a remote area. It's not easy to go there. And so there are logistical constraints that may affect what you do. But complexity could be very different. You could have different stakeholders, different people with different views and you don't quite know who the decision makers, and that could affect what you do. So there is a difference between difficulty and complexity, but at times they could both be the same as well. I mean, complex scenarios are difficult scenarios. So yes, that's important to recognize. And I think in several of the methods that we talked about, it was very clear. And sometimes you say you're talking about social norms and things like that. These are difficult things to measure. These are hard to measure, not easy. And some methods are more appropriate than as compared to something that's a little more straightforward. So our choice of method also varies depending on the type of scenario that you're dealing with. Another point that you raised was, yes, who is it important to? Who are the different people? So is it coming from your perspective? That this is something important, or is it the people that you're working with? And so that's where the question of different stakeholders comes in, and their different perceptions come into the picture as well. And why, again, in some of the methods that we explained, having these groups of people. So even in the case of outcome harvesting, you have your project staff, you have, the implementers, you have people who are funding the whole entity, you have the ministry out there. Having them all as part of the conversation to verify any outcomes and validate the outcomes, I think is really helpful for them to say they come with their perspectives on what's important, and a joint decision is made that this is really important. So yes, bringing those is important too. And lastly, the last point you mentioned, I think, was about this balance between simplicity and complexity. Yes, it's all very complex, but I found that in some of these methods too, it's like you start with the complexity and you kind of tease them out and narrow them. In some cases, I felt that, like with the ripple effect mapping, perhaps, that you start with, or this significant change, you start with stories, actually not the significant change, the ripple effect mapping. You have individuals and they keep bringing in their little stories together, and we keep pushing and pushing, and in fact, grow much broader. And suddenly you have this wealth of, 25 potential intended or unintended outcomes. That's a lot to handle. And I think it's really very hard. That's where the skill of the facilitator, the skill of the evaluator really comes in, to look at that information, to pick out what's relevant and say, these are the few most important things. Because having 50 outcomes out there, relationships, really doesn't help you in any way. So I think that's where the skill comes in trying to pull out smaller stories out of it. Or even in outcome harvesting, you start off, in this example that I presented, you start off with 45 outcomes that are harvested. But really, as you go through the process, you might pick 10 of them that are truly relevant, because that's where the simplicity in some ways comes up with smaller, more straightforward, understandable statements that you can use with key stakeholders to help move things forward. Otherwise, it's a mass of information. I don't know if I answered that last part appropriately, but yes, we're all on the same journey, trying to figure this out.
Could I speak to the one of the other points that Mark, you brought up about the question in the FAQ about the importance of early childhood development and advocacy, and you were saying about, in the early phases of some of these things, when you're introducing them, is your focus on buy-in, or can do these complexity-aware approaches potentially have a role to play? And I wouldn't say that you would focus on one or the other, but I do think some of the approaches are very well suited for early in this kind of activity. So things like outcome mapping, which can help you, work to look at your causal pathway of how you plan to change or introduce early childhood development programming. And then looking at this pathway, see how it's unfolding early on and making changes to it as you go to make sure that what you're doing is really reflecting the situation on the ground and is useful, so you can make tweaks to these programs and adapt as you go so that you're not just following some causal pathway that may not be, useful in a setting. I think some of these and the causal link monitoring can be really useful early on to help guide how you roll out that advocacy or the programming. So.
Thanks both. Shukufe, do you want to handle questions?
Thanks, Mark. I actually have a few colleagues that I've given access to be unmuted. So Kimberly Norris has been sharing some really interesting stuff. Kimberly, do you want to just come in and share some of your thoughts? Maybe introduce yourself, let us know where you're from, calling in from.
Yeah, I'm calling in from Annapolis, Maryland. Hi, everybody. This is in the United States. This has been a really terrific presentation. Thank you. I've learned a lot, and I even use these methods, so I've learned a lot. But I just wanted to note, I would really appreciated Mark's follow-on to it, because there are a lot of places where the rubber hits the road, and where you really do find that using these complexity aware methods helps you to understand how something might apply or not apply to another condition, context, situation, geography, cultural situation, more than something like an RCT. That was one of the points I was making. And to Emily's point, I really appreciate thinking about using complexity aware methods, and particularly developmental evaluation, where you can apply methods in the moment, in a sense, to help move a program in a potentially better direction before it gets too ingrained, before people get comfortable or people say this is the way it's going. It's almost better to try to do some of this assessment intervention type of thing to enhance a program early on. Evaluation and programming go hand in hand. I don't see them as separate. They're strategic planning. They're part of strategic planning. They're part of the intervention if you're doing it well. And they're not just some afterthought that's done after to find out if something worked or not. Ideally, they're actually enhancing the program as it moves along. And we've been able to use developmental evaluation in ways that, literally made or broke a high dollar project. So those are some things I was thinking about as you were talking, but really appreciate this presentation. Thanks.
Does anybody want to react to that at all? Any thoughts, Soumya, Emily?
No, I mean, I think the point that Mark brought up about, generalizability as well, I think is just very important. Some things can be easily scaled up. At other points, you really need to look at the context and not just assume that things are to be used everywhere else. And especially in the field of, I don't know as much about early childhood development, but we come from the global health world. There is a lot of thinking just of this developmental approach and this whole process of adaptive learning and learning as you go. And that's why I think the use of different methods at different time points are really important, sometimes to answer big questions at the end, or otherwise during the process you can use them in many different ways to answer points at questions at different points, and adapt your programs along the way to make sure that they're most appropriate.
Thank you.
Shukufe, can I just add one thing to that? I mean, one of the thoughts I had, and it was linked to me, I think one of your slides you put up around the norm, it was about family planning, or there was something, and I sort of made me think that another mistake we often make, and it's fine because you obviously can't account for everything. You can't measure everything, and particularly in this research study, there are limitations, but often I think we miss some of the big things, So for example, when I think of a lot of the work I've done around in parenting programs, is I do have the sense, and I think there's quite a lot of evidence out there that much of your parenting you learn from how you were parented. So you have a kind of a mental model maybe of parenting that of how you were parenting. It's kind of a natural thing. there are very few studies that ever look at that as some kind of mediator, moderator. We kind of assume almost it's a blank slate. And so I think that's, and then also when we start thinking about family planning, one of the things that are the most difficult things to change are norms. And so we'll make idle reference to this somewhere, but because they're difficult to change, because they're difficult to measure, and all the things, it's sort of it's like this elephant in the room that's there, but we're not quite getting to it. And that actually then when our projects fail, we think it's because of the project or the program, but actually the same program in a place where there'd been a bit of a shift in norms may have been quite successful, much more than without that. So yeah, I just wanted to throw that in as well.
I think particularly in the case of the social norms case also, it's like sometimes, you follow quantitative approach. It's difficult to measure some of these things. These concepts are not easy. And so you have norms and trying to break it down to, yes, what knowledge do you have? What attitudes do you have? What intentions do you have? How does it change your behavior? There are multiple steps along the process, and teasing them out and trying to find the best ways to measure them. It's not straightforward. And that's when the depth and the richness of information you get from people, I think, is most relevant.
I'm so curious to hear from Johnny, who just did the previous session. Johnny, do you want to come in?
Sure. You guys hear me? Does this work?
Yeah.
Yes.
Yeah.
Yeah, no, I mean, I guess there are a couple of issues going on in my head. One is just the straightforward, all of these effects. I mean, a program, especially if you're intervening in a system, can have all kinds of consequences. And let's pretend they're positive, so we don't have to worry about people hiding bad news. But it can have all kinds of consequences that are truly profound but invisible to people who are recipients of the program services. And I mean, I did talk about complex systems, and so you can think about that. You can think about emergent effects. You can think about developmental effects. I actually spent a lot of time thinking about programs as organisms evolving on a fitness landscape, which is a very complex system-y kind of way of thinking about things. But so you get these sort of evolutionary changes that really matter, that can't be, that aren't obvious from looking at the program. Now, some of it is simply time, right? It might take a year for something to happen. And so you've got a sampling problem in terms of when you're going to, collect your data. But I just think a lot of these things are the connections are not obvious. And that's because, these things are all networked, systems evolve. It's hard to see these things. You might have some situation where you're dealing with households, but the local civic government sees what's going on and makes some decision that's based on their observation of what's happening in the program, but who would ever know if you didn't look for it? So that's just sort of what's going on in my mind. I mean, there are ways to do this, but I think that if you stick to, let's talk to the people who are informed observers of the scene, you risk not getting a lot of good information. That's all. I don't think I've said anything that everybody doesn't know. I mean, there's no secret about this or anything like that. It's not that I have esoteric wisdom, but I do think that the issue has to be dealt with in complexity aware monitoring, because in fact, the problem has to do with the changes in complex systems.
Any reflections, Emily, Samia?
I don't have anything specific on that, not right now.
Thanks,
Emily,
Jenny.
do you have anything?
No, just I fully agree with what Johnny is saying. And yeah, using these approaches to map out these pathways in my own work has
May I
just
ask a question?
Oh, sure, go ahead.
My question is with Mark.
Can you
Mark,
introduce yourself, Malik?
Yeah, I'm Malik Muhammad Islam from Pakistan.
Go ahead, Malik.
My question is with the mark. I want to ask how can we develop deep community relationships for the early childhood education in Pakistan. I want to ask some tips and that how can we engage the community. In Pakistan, this is very difficult to engage the community in early childhood education, as I am doing work on early childhood education in Pakistan. Thank you.
Great question, Malik. Mark?
Yeah, thanks, Malik. It is a great question, and I worry that I'm perhaps not the best person, having never been to Pakistan. Uh, but I mean, broadly, I suppose my first step would be to, approach people with experience in Pakistan. So there's Aisha, there's Atif Rahman. There are various, from a research perspective, people around the world who have had deep and long experience and work in Pakistan in early childhood. So that might be the first step, and I'm sure they would be open to it. The next is actually just around developing relationships. Most of this is all relationship based at the end of the day. Nobody can swoop in as some knowing other and tell people what to do. So the extent to which you can build networks, link to existing networks, start, building relationships and change is going to take time, and you do it in really small steps. So kind of find an existing network, find a single person working in the field, build a relationship, build trust in that, and slowly build from there. But this is not something that happens quickly. I, for example, have a research site in an area in Cape Town, and we've been there for over 20 years. It's taken close to 20 years to develop some of those relationships. And when we have a problem and we have an issue in the community, we actually have deep roots to be able to kind of speak to people to solve it. But none of that happened quickly. A lot of it was, taking 2 steps forward and 3 steps back, and you've got to be in it for the long haul. Particularly if as I think Sumya and Emily did so well today, that if you're talking about complexity and you're talking about deep engagement with communities, this is not a once-off thing. You don't run in and do a quick project and then flee for the flee. You've actually got to get people to trust you across time. So I don't have any quick fixes. It's just like putting your head down, developing relationships, building trust, and then talking to as many people as who have experience in your context. I think that's very general, but I don't know. I don't know if anyone else can offer, Malik, anything more specific.
Thanks, Mark. Ivanka, do you want to come in? You had some interesting comments in the chat, and then also Terry.
Yes, do you hear me?
Yes. Where are you calling in from?
I'm calling from Bulgaria, and I'm participating in the masterclass with a lot of passion because just 2 weeks ago, our government resigned and I stepped down from the position of Minister of Labor and Social Policy. And it was in my hands to actually channel the first early childhood development national plan in our country. I'm a PhD with ECD research background. And I would like once again to thank you all for this amazing presentation, to go through so many methods and to clarify the applicability at different stages of interventions and programs and processes is just amazing. So thank you for the presenters. My real challenge, and this is a challenge in Eastern European countries, especially the ones with former communist experience, is how to involve children in evaluation work, because we kind of managed to capture the points of view of different marginalized groups, especially in the context of previous training sessions on equity. But my question always is how to capture the points of view of children given their vulnerable age. This is something that I think the research community here in my country and former Soviet Union bloc are having difficulty with, because we take the points of all the other stakeholders, but not necessarily children. And the traditional point of view is, oh, they're very young, they cannot communicate, articulate. So it is an open question, but thank you all for this amazing presentation. And thank you, Zonji, for the opportunity for all of us from different parts of the world and different backgrounds to attend this amazing masterclass and be change makers around the world and make it better for children in their early years. Thank you.
Thank you, Ivanka, for sharing. So we only have 4 minutes left in this session. So over to the panels for quick responses to Ivanka, and then we close out.
I don't have a specific response regarding, children and early childhood development from that context, but we struggled with the same issues in the health field as well. We recently developed a scale to measure pediatric experience of care of young children at health facilities, and really the conversations were with their caregivers. And so because of sensitivity issues and it's hard to get information from children, but they are absolutely relevant. So it's something that we're all struggling with across disciplines.
Great.
I'm sorry, Shigiba, I just have to say something about that. So Ivanka, just thank you for that. So I think if we globally, if we don't find a way to do that in a much deeper, more profound way, everywhere we work, we're all in deep trouble. So I think it's like absolutely central. We don't talk to children, and when we do, it's from a height, and we don't really listen to them. We don't co-create with them. We take things for their sign off, and in fact, it will be young people and children and youth who will have the opportunity to fix our rather depressing world right now. So yeah, we have to do it. So thank you for bringing that up.
Thank you so much. Again, Mark, Emily, Samia, that was excellent. Shreya, do you want to screen share so we can close it out? All right, colleagues, I know a lot of you are repeated, but I don't know it is the first session, so I just need to do this over and over again. For the certificate, 7 out of 14 complete the survey during or after the session, not before. Next slide, Shara. And we see a lot of great content coming in through the chat, a lot of people sharing, so please pay attention to that. So the 2 sessions that happened today, you can find them in the next 24 hours. They'll be on the website with everything there. Tomorrow, we have session 11 and 12. Tomorrow's the second last day of the series. We'll have Mark again, along with Julia Kaufman. Sorry, Cher, could you go back to the next slide? Yeah. Aligning mental models and approaches in systems change efforts. And then we'll have sessions 12 with Cynthia Rayner and Sharon Goldfeld. And yes, so if you haven't registered, you still can. And please do share the last few remaining sessions as widely as possible. Also, there's an opportunity by the Palix Foundation in case you guys want to keep the learning going. They're offering a masterclass on resilience scale. So you can take that down. That information is shared in the chat as well. More resources on ECDAN's website. Continue the conversation on ECD Connect, where you can connect on this topic. And a big thank you to the ECDAN team, to Shreya, Hannah, Catherine, Carol, and Hamid for everything you've done. All right, colleagues, with that, we call this day a close. 2 more days left, and hope to see everyone there in full force the next 2 days. And again, a big thank you to Samia, Emily, and Mark. Have a wonderful day, evening, wherever you guys are, everyone. And see you tomorrow.
Thank you, everybody.
Thanks, everyone.
Thank you.
Bye.